Let's do some medical dosage calculations. Number 1, your child is prescribed a medication with dosage instructions of 20 milligrams per kilogram per day to be given 3 times a day. If your child weighs 75 pounds, what's the max dose he should receive? Okay, so we start with your kid. Your kid is 75 pounds. But recall, the dosage are in milligrams per kilogram. So the first thing we gotta do is get your kid out of pounds and into kilograms. So 1 pound is 0.4536 kilograms. So that step right there gets us into kilograms. And now we can use our conversion of 20 milligrams per kilogram. Kilograms go away. So when I multiply straight across, this is going to tell me 680.4 milligrams. This is the total milligrams your kid should get per day. Now, it said you're doing this 3 times a day. So, if your kid is getting 680.4 milligrams divided by 3 times a day, each dose should have a max of 226.8 milligrams per dose. Boom. So, pounds to kilograms, kilograms to milligrams, divide by how many doses. What about you? You are prescribed medication, dosage of 10 milligrams per kilogram per day, to be given twice a day. You weigh 145 pounds. What is your max dose? Okay, so you start with you. You are 145 pounds. First thing, get you out of pounds, get you into kilograms, because we don't know how much druggage you need until your pounds are gone. So now we can use 10 milligrams per kilogram. Again, now we find gives us our total kilograms. So our total kilograms is 657.72 milligrams, right? That's the total. But remember, your directions say twice a day. So we divide that by 2, and we get 328.86 milligrams per dose. Final answer. Number 3. The dosage on a medication is 15 milligrams per kilogram per day to be given 4 times a day. Max dose for someone weighing 200 pounds. So you start 200 pounds. We're going to change 1 pound is 0.4536 kilograms. That makes your pounds go away. Okay, well, the dose is 15 milligrams per kilogram. That makes your kilograms go away. So we now know the total is 657.7, nope, that was the last problem. I copied, sorry about that. 1,360.8 milligrams total. Well, you know as well as I do, you're getting this 4 times a day. Divide it by 4, and you should get 340.2 milligrams per dose. And there you go. All right, let's mix it up a little bit. A certain drug is available in 20 milligrams per 5 milliliter doses. A doctor orders filling 50 milligrams. How many milliliters should you give? Okay, so we know that the ratio is 50 milligrams to 5 milliliters. Now think about it. The doctor orders 50 milligrams. I put that on top. You're trying to figure out how many milliliters. We have what we like to call a proportion, right? We've done these before. So if you know that this is the way it works, 20 milligrams for every 5 milliliters, well, then what's the ratio that goes with it? So I cross multiply. So recall, 5 times 50 is 250. 20 times x is 20x. Oops, I forgot my x. Divide both sides by the number in front of x, and you should give that patient 12.5 milliliters of this drug. Number 5. The doctor orders 1.5 milligram per kilogram of a drug for a child weighing 75 pounds. The drug is available as 125 milligram per 2 milliliters. How many milliliters must you administer? Okay, well, the first question is, how much of the drug does the kid get? So the kid gets 1.5 milligrams per kilogram, and the kid is 75 pounds. So we start there, 75 pounds. Change that pounds to 0.4536 kilograms. Okay, so that gets me out of pounds. So now we can say 1.5 milligrams per kilogram. The kid should get 51.03 milligrams. Okay, so now we can say the drug is available 125 milligrams per 2 milliliters. And we know the kid is 51.03 milligrams. How many milliliters should we get? Right, so we do our cross multiplying, and we get 102.06 equals 125x. Divide both sides by 125, and this kid should get 0.82 milliliters. Right? Okay, super important to change to kilograms first, right? You're going to overdose people if you don't. And last problem in this video, number 6. A drug is available in 125 milligrams to 5 milliliters. The doctor orders 3 milligrams per kilogram for a child weighing 19 kilograms. How many milliliters should you give? Now, this person's already in kilograms. So we have 19 kilograms, and we know they get 3 milligrams per kilogram. So the kilograms go away, and we end up with 57 milligrams. Okay, not bad, not bad. So if the drug is 125 milligrams per 5 milliliters, and this kid gets 57 milligrams, then we cross multiply, and 285 equals 125x, divide both sides by 125, and x equals 2.28 milliliters. And there is your dosage calculation practice in medical situations.